everyone. Thank you so much for joining today's NeedyMeds special topic webinar, Becoming an Empowered Patient. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And before we get started with today's presentation, I just wanted to go over a few tips. If you have questions, you can feel free to type them at any time into the questions section of your GoToWebinar control panel. But no, we will reserve answering questions until the end. If we don't have the time to answer your question, we will follow up with you personally via email. Of course, we will also provide you with the contact information for NeedyMeds and Mended, who's presenting today's special topic webinar. Also, I wanted to let you know that this webinar is being recorded and will be available for viewing on the NeedyMeds YouTube channel. And you can find both PowerPoint presentations accompanying today's webinar in the handout section of that GoToWebinar control panel. So with that, let's get started. For those of you that are not familiar with NeedyMeds, we are a national nonprofit founded just over 2 decades ago by retired physician Dr. Rich Sagel, who is still our president. On your screen is our updated mission statement, which is that we work to educate and empower those seeking affordable health care. And here, bear with me, sorry about that. Here is a screenshot of our website, because our website really is the face of our organization. And I just wanted to point out a few things. If you are looking for programs to save on your medications and healthcare expenses, you will find that under the Patient Savings tab. I mentioned in the beginning that this webinar is being recorded and will be available on our YouTube channel, and you can find a link to that right there on the top right of our homepage with the rest of the social media icons. It's the third one from the left. And to see what other webinars are scheduled, check out our calendar of events on the bottom right side. So, as I just mentioned, a big part of NeedyMeds' mission is to educate people. And we define that in 2 ways. One, certainly by educating people about NeedyMeds and the resources we have to offer. And 2, by making our users aware of other organizations and resources that will prove useful in their healthcare journey. And that is why we are so pleased to have Andrea Bear, the Director of Patient Advocacy for Mended Hearts and Mended Little Hearts, here with us today to share her expertise. So first, let me tell you a little bit about Mended Hearts. Mended Hearts is a national and community-based nonprofit that offers the gift of hope to heart disease patients, their families, and caregivers. Their mission is to inspire hope and improve the quality of life for heart patients and their families through peer-to-peer support. Yet today's webinar is going to touch on a subject that is important to everyone, not only heart patients, which is how crucial it is to become an empowered patient and be an active part of your own healthcare team. So now let me tell you a little bit about Andrea, who is going to walk us through today's presentation. Andrea has a Master of Science in Nonprofit Management and Leadership and is currently the Director of Patient Advocacy for Mended Hearts and Mended Little Hearts. Andrea has been deeply involved in advocacy efforts and working to ensure that the patient voice is at the table. Andrea resides in Pittsburgh with her husband and 4 children, but we're lucky enough to have her here with us now. So without further ado, I'm going to go ahead and hopefully seamlessly pass the mic and the screen to Andrea. Bear with us. There may just be a moment of silence. We'll make that transition. And with that, Andrea, I'm going to let you take it away. Thanks, everybody.
Great. Thank you so much. Can you see my screen okay?
Perfectly clear, and we can hear you as well.
Excellent. Thank you. Thank you so much for having me today. I'm excited to be here. As Carla said, I am the Director of Patient Advocacy and Program Management for Mended Hearts and Mended Little Hearts. A little bit more about Mended Hearts. We are in over 300 chapters across the country, serving 460 hospitals. And we are a very unique organization because we are volunteer run and we serve the lifespan of heart disease from the smallest infant all the way through the lifespan to old age. We are there to support, educate, and advocate for all of our heart patients. So a little bit about me and why I can be considered a quote unquote expert in the field. My son, who you'll see on the screen here, was born in 2009 with a congenital heart defect and Down syndrome. He had open heart surgery at 11 weeks old, and he has had multiple surgeries since then in his short life. One of the things that I found was that even though I was a mom of three children, he was my third, and I had been a mom for 18 years, I was really very inadequately prepared to deal with healthcare decision making. It was a very foreign concept to me. And so navigating all of the special medical needs and the journey was very scary and very daunting. And when I started online resources, it was really not a very good scene. Lots of information about the bad things that happen, because people tend to be very vocal about all of the bad things that happen to them, but not a lot of good. And I felt very alone, even though I was surrounded by my family and friends. And I think most importantly was I felt confused and overwhelmed. So that left me at the mercy of doctors. I had to put kind of a blind trust into the doctors and surgeons who were taking care of my son, because I felt out of place with his conversations about his medical care. And I really kind of felt out of place asking questions, because doctors know best, right? I mean, that's the way I was raised. They were the professionals, and they were the ones who knew better than I did. But the one thing that they didn't know was my son. And I found very quickly that becoming empowered and asking for things would get me what we needed to get for him. This quote by Oprah Winfrey, I think, sums up the empowerment of a patient. You get in life what you have the courage to ask for. The most that they can say is no, right? But if you don't ask, then you're never going to get it. And so let's discuss what empowerment really is. So first and foremost, it's an earned privilege and not a given right. We're all patients, but we have to earn the right to be an empowered patient. And that takes responsibility and ownership. And it takes us asking why and understanding the whys so that the guidelines can be applied. We have to make sure that we weigh the impact of decisions on all of the stakeholders involved. That includes the patient, the caregivers, family members, the doctors and nurses, the medical teams that are taking care of you. All of those things need to weigh in the impact of the decision. And it's about making more trade-offs and not less. And so you should become the CEO of your healthcare, because empowered patients who become 100% partners in their healthcare are educated and they make better healthcare decisions. And when you make better healthcare decisions, you have better outcomes, which means you have a better quality of life and a better recovery from whatever is happening. So the first step in the process is to educate yourself. And so this seems fairly simple on the surface, but really educating yourself in the healthcare department can be very, very overwhelming. Research shows that you need to hear a message 7 times before you completely retain the information. You know that doctors aren't explaining the information to you 7 times, right? So we need to make sure that we keep asking until we really, truly understand. And during the initial diagnosis, you may be in emotional crisis, even if you don't think you are, and therefore you're not retaining the information. It's even harder for you to grasp what they're saying. I can remember sitting in the hospital bed 4 hours after my son was born, and the doctor explaining to me what was wrong with my son's heart, and he was using words like atrioventricular septal defect. And the only thing I could think in my head was, I don't even know how to spell that. How am I going to Google it? So I was definitely in an emotional crisis, and the retaining the information was very hard for me. And the medical language was really difficult to understand. What I could have done at that point is to say to him, I'm sorry, I don't understand what you're saying. Could you use lay terms for me? And what he could have said at that point is, your son has a hole in the center of his heart. Sounds much easier to comprehend. And at the time, the big words really weren't important at that point. And so as we go through the diagnosis, as I said, you want to make sure you truly understand what the diagnosis is and what the diagnosis means for you personally. Everybody is different. And so even if you have the same diagnosis as the patient before you, it may mean different things for yourself. And you want to also understand your short-term and your long-term prognosis, and if it's a lifelong care versus short-term treatments. And the most important thing is to just keep asking questions. Ask the questions until you feel really comfortable with what the answers are, because then you can be a part of the team. If you understand your diagnosis and it's been explained and you're being heard, and you've asked your questions, then you're a part of the team. And one important thing to remember is, don't assume that the first option is the best option for you. You need to ask, are there other therapies or treatments to consider? And then you need to do your research, because are you in the right place for that? And are you weighing all of your options in that situation? Because sometimes if you're at a certain hospital and they don't offer specialized therapies or treatments, they may not even offer that to you because they don't offer it at their hospital. So you need to ask the doctor, is this really the only option I have? Or are there other options out there that could be considered for me? And you want to voice your opinions, because your voice matters, your story matters. If you're uncomfortable with something, speak up and ask for a solution. I love this image here. The guy says, I hate cats. I want a dog scan. So we go back to, you might not always get what you ask for, but it can't hurt to ask. Remember that you need to be kind and considerate in your requests, because you want to give the respect to the medical team, because you want the respect in return. You should be equal players on the team. And if you're afraid, say so. Tell your doctors, I'm really afraid of this. This really scares me. They can help you be more comfortable, or they can get you some help to feel more comfortable in the situation. Don't suffer in silence. If you have to have a surgery, there are a lot of questions that you should be asking before your surgery. Certain things about the survival rate at the hospital, average recovery time, what complications might happen, how the care team works together, what the mortality rate is at the hospital. Now note that the mortality rate may not be a good indicator, because some hospitals take many high-risk patients, and so therefore they have a higher mortality rate. But you still should ask. And then, what resources are available for me at this hospital? It may come that you aren't in the right hospital and you may need to go somewhere else. And if that's an option for you, then you definitely want to consider that. There may also not be an option at that point due to insurance or travel restrictions. And every single person is different and everybody's experience is different. But you want to make sure that you're really, truly understanding what those what the expectations are for each of the procedures at the hospitals. And then you need to think about what will work for you. Will you be able to, afford the treatment? Will you be able to obtain the medication? Because if you can't afford the medication, or you can't get the medication, you're obviously not going to be able to take it. And that's going to affect your treatment outcomes. So what kind of lifestyle changes do you need to make? Are they things that you're willing to do? And you need to be honest with yourself and honest with your physician. If they tell you that you have to eat a certain diet and you think to yourself, there's no way that I'm going to do that, you need to be honest with the physician and say, look, I think this is going to be really hard for me, and I don't know that I'm going to be able to do it. Because you can't, if you don't, then you're going to be lying to yourself and lying to the doctor. And this is where being a part of the team comes in, because you have this open conversation. You may say, I really can't afford this $50 copay. Is there a generic that I could take that does the same thing for $10 a month? Or, I really can't go to cardiac rehab, which is 40 miles away 5 days a week. Is there a different option that I could do? And let the doctors help you set up a plan that works best for you. And then online research. And I always like to say, please proceed with caution. Go to only reputable websites, no Wikipedias. Go to websites that you know are good research websites, like the NIH and the CDC. Hospital websites often have a lot of research on there. Be careful comparing stories from other individuals, and be careful comparing hospitals or doctors based on the word of others. Comparing a hospital or a doctor to somebody who has had an experience with them is very hard, because if they've had a good recovery, their doctor is the best, right? If they had complications, then their doctor is the worst. But it doesn't mean that that doctor is not a great doctor, and that you wouldn't have really good outcomes with them. So do your research to prepare for questions for your healthcare team. Don't use the research as facts for your specific condition. I remember going to the doctors with my papers in my hands, and I said to my doctor, or to my son's doctor, I said, so this AVSD, as we call it, is it a complete AVSD or a partial AVSD? And he looks at me and he says, I see you've been Googling. And I said, yes, I have been. But that is the way you want to make sure that you do things. And then you want to connect with disease-specific organizations for more information. Organizations like Mended Hearts are there for every type of disease-specific, any type of diseases. And they're very specific. And so you can get lots of great information and education from those organizations. Once you've got all of your information and you feel very educated and confident, then you can really truly be a part of shared decision making. And shared decision making requires dialogue between provider and patient to reach an agreed course of treatment. And you see in the image here, you have the doctor talking about the evidence and the risks of tests, and the patient talking about their preferences and their risk tolerance and their test feasibilities. And it goes around in a circle until a collaborative plan is worked. And you need to make sure that you have been given the time to digest the information and think about your decision, and make sure you've talked to your family or your caregivers and that you're on the same page. You also want to make sure you're confident in your decision. Now, there are times that are very crisis oriented and you don't have time to make all of those decisions in that way. But we're talking here about when it's a decision about a treatment or something that you may be able to have that dialogue with your doctor prior to doing so. And so one more graphic here about shared decision making. We used to go with a paternalistic type of decision making, which is what I was raised to think, and I know a lot of other people were, is that the clinician is the professional, and so they give you information and recommendations, and you just listen and say, okay. And then we kind of moved into an informed medical decision making, where the clinician gives you information and then you make your decision. And now the patient voice has finally evolved into a true shared decision making, where information and recommendations both come to you, and then you go back with your values and your preferences, and we go around and around and around until we reach a great plan. You want to make sure you know your rights. And these aren't rights like that, by law rights, but you do have the rights to be treated like a patient and as a part of the team. You have the right to ask questions and get answers. You have the right to a second opinion or a third opinion or a fourth opinion. Do not feel like if you ask for a second opinion, your doctor's going to feel like you don't believe them or trust them. It's your right to ask for that. You also have a right to suggest alternatives, and you have a right to feel confident in your team. If you don't feel confident in your team, then there can be changes made for that. You have a right to change your mind. If you start on something and it's just not working for you, you have a right to change your mind and have a decision a different way. And you also have the right to appeal decisions if you don't agree with them. Now, every different situation has a different type of appeal and a different process, so we won't get into the details here. But you definitely have the right to appeal every decision if you don't feel confident in that decision. It's also very important to know that caregivers can play a very integral part of your healthcare team, not only for support, because support is very vital to your journey, but also having them attend and include them in your conversations is very important, because sometimes caregivers actually have a better insight into certain things than you do. Or maybe if you're like my grandfather, he didn't want to admit that he wasn't feeling well. He didn't want to admit that he couldn't climb the stairs like he used to. But my grandmother sure saw the difference. And so she was able to tell the doctor, he says he's feeling okay, but his energy level has decreased and he really isn't feeling well. And so there's a different insight there from a caregiver. And so make sure that they feel empowered and you allow them to feel empowered to have that communication as a dialogue with your healthcare team. Not to be a tattletale on you, but to be truly a part of the team. And then having two sets of ears can help. My husband and I would attend my son's doctor appointments in the beginning together, and we would both come out, and it was very interesting how he would pick up on certain things and I would pick up on different things. And we usually always picked up on different things. It was never the same thing that we really sunk in. And so it was great to have both of us there to be able to pick up everything that was happening. And then I think one of the most important things that we should make sure that you understand about being empowered is that it's actually a responsibility. And so you need to own your decisions that you make with your team and make sure that you're confident in that decision, realizing you can change your mind if it's not working, but you need to communicate with your healthcare team at every step and take responsibility for your health and for your future journey through this healthcare decision making. And finally, one of the most vital pieces of the journey is peer support. If you connect with others, they can help you navigate this journey because they've been there and they've went through the journey, and they have lots of really great advice to share. You can share your struggles and your fears. You can get support for lifestyle changes. One thing that I found is, I know what is right to feed my children. I know how to feed them healthy, but when I work until 5 o'clock and my daughter has dance at 5:30 and there are 3 kids needing to eat in the house, it sounds really easy and very appealing to drive through the McDonald's drive-through on our way to dance, even though I know it's not good for them. So finding out ways to really make those dinners quick and make ahead and prepare the meals in the crock pot. And those are the types of things that I have found really valuable from my friends. And then you also get your emotional support from them, and you get educational opportunities, just like the one we're doing today. Our organization and others like us in the nonprofit world, we do a lot of educational webinars and training opportunities that you can become a part of to get a lot of disease-specific information. So you don't want to miss out on that. And finally, that's all I have. So I'm ready to take questions. Carla, whenever you are.
Fantastic. Thank you so much, Andrea, for that very thorough and invaluable presentation. As our audience members got to see why we're so proud of a partnership with Mended Hearts, and we enthusiastically welcome Andrea back anytime she wants to share her expertise. This is a good reminder that if you have any questions, I do see some people submitting them. But again, if you do have questions, you can send them into us in that questions section of your GoToWebinar control panel. And a reminder, we won't get the chance to answer all of our questions, but don't worry, we will absolutely follow up with you via email. In the meantime, I want to remind everybody of a few things. One is what you're looking at on our screen. My screen right now is some of NeedyMeds' most popular and effective ways we help people save on or afford their healthcare expenses, which is our primary goal here in addition to educating people. And we're hoping you count NeedyMeds among your sources of support and part of your team as you get to work and stay healthy. As Andrea mentioned, oftentimes an obstacle is simply being able to afford the medication or therapy you needed recommended by your doctor or healthcare team. So we do hope that you remember we're here to help you. A couple of other things that I did want to point out. Andrea also talked about proceeding cautiously when you are looking for information on the internet. I wanted to give everybody the heads up that last year we did a presentation, a webinar specifically about how to find reliable information online. And although we did that webinar last year, the information and message is evergreen. So if you'd like me to send you a link to that webinar, please let me know by sending me a message in that question section of your GoToWebinar control panel. But you can certainly go to our YouTube channel and just browse through other previously recorded webinars, because as Andrea also said, a big part of being empowered is being educated. Andrea also mentioned that statistics show it takes 7 times for a message to be repeated for the person to actually receive it or absorb it. It's a good time for me to remind you that Andrea's presentation is chock full of information, and we do have a lot of people listening in that are in the middle of a health crisis for themselves or a loved one. So just a heads up that this webinar is being recorded, and it will be available on the NeedyMeds YouTube channel so that you can not only refer to it, but you can also share it with other members of your healthcare team. And again, you can find copies of our PowerPoint presentations in that handout section of your GoToWebinar control panel. Again, a reminder, go ahead and submit some questions, any questions that pop up, and we'll do our best to get to them. Before I direct those questions that are coming in for Andrea, one other thing I want to mention is an additional resource that NeedyMeds has called Health Storylines. Storylines is a free self-care app that makes it easy for you to track and manage not only your health, but the health of your loved ones. The app does have the NeedyMeds drug discount card preloaded into it, and that's important because our drug discount card can help you save up to 80% off of the cash price of your prescriptions. But it also acts as a medication reminder, a symptom tracker, a mood tracker, a vitals tracker. It has a pain rating scale. And yes, we get this question a lot. It does sync with wearable devices. So please do check that out. Again, it's a free app, and you can download it through the iTunes or Google Play stores. Also, here's a snapshot of our other upcoming webinars. If you see something you are interested in, you can register on the calendar of events on needymeds.org. And again, that is in the bottom right hand of our homepage. So as we get to the questions coming in, I'm going to leave this slide up, which is the contact information from Mended Hearts, and also the contact information for NeedyMeds at the bottom of that screen. So Andrea, some of the questions coming in. Here's an important one. What do I do if I really want to try a new medication that I've heard is working well for others, and my doctor is telling me it's not really any better than what I'm on now?
That's a really great question, and I'm sure that it happens a lot. So I think that what you would want to do is get your information about the new medication that you would like to try, maybe from some research that's been done or the trials that were done on the effectiveness of the medication versus the effectiveness of the medication that you are currently on or the one that the doctor wants to put you on. And ask your doctor with those papers in hand what he thinks and why he or she thinks that the other medication is not right for you, and have that dialogue. Explain to the doctor why you want to try this medication and have them give you reasons why you don't need to. And then continue the dialogue until you get either feel comfortable with not getting the new medication or your doctor feels comfortable with giving you the new medication.
Thank you for a thorough response, and thank you to our audience member for asking that question. Another question coming in actually is directed to me for NeedyMeds. Can somebody who has insurance for medications in place still use NeedyMeds? That they were told by a pharmacist no. So the answer is an absolute yes. So what I mean by that is NeedyMeds is a resource that free and anonymously through our website and helpline will do our best to connect you to a program that will help you afford your healthcare expenses, including medications. Now, oftentimes people don't come to NeedyMeds because they have some insurance coverage or they have some drug coverage, and they make the assumption, the same assumption I made before I worked at NeedyMeds, which is, well, I've got some insurance, so NeedyMeds won't have a program that can help me. And that's not always the case. There are a lot of programs and resources for people that have coverage, some drug coverage or insurance coverage. So what I would say is visit our website, check out that patient savings tab. But if you're not comfortable doing that, and if you would rather speak to an actual person, which often I like to do as well, please reach out to our expert call center counselors at 1-800-503-6897. And I had the phone number wrong on that slide. It's 6897. So I just caught that. I was saying it out loud. But we do hope you reach out to our counselors, because not only will they be able to help you afford, hopefully, a medication and a healthcare expense that you're struggling with, but they may be able to find additional support that you didn't even know was an option for you. So thanks for that. Another question coming in for Andrea is, I've been having problems specifically with pain in my feet, and my doctor and my rheumatologist are telling me it's not related to my RA. But the foot doctor is telling me there's nothing wrong, and I feel like nobody believes me. What do I do?
Wow, that's a great question. So I think that you should go back to your doctor, and I would start with your PCP doctor and say to them, these are the problems that I'm experiencing. Can you please help me figure out where to go next? Maybe it's blood work to determine if there's anything going on. Maybe the doctor has a different specialist he could send you to. But don't ever be discounted if you're having a pain somewhere and the doctors are discounting that pain. Make sure that they understand that this is really a problem for you and that you need their help in fixing it. If your doctor is not listening, find another doctor who will listen. I don't think that anybody should live in pain just because a doctor is not understanding what is happening.
So important. So important. And again, thanks to our audience for being for participating in the question section. Because oftentimes I feel like if there's a question burning in your mind, the chances are that somebody else has that same question. Andrew, we have somebody asking specifically about how to find a Mended Heart support group. And if there isn't one right where they live, are there other ways that they can connect with Mended Hearts?
Yes, if you go to our website, mendedhearts.org, and you click on the button that says connect, you can look for a chapter with your zip code or by your state. And if there isn't one in your local area, we have an online community of support that we offer support and education and research resources online to those who aren't close enough to us. They can join and get our newsletters and our Heartbeat magazine and stay connected that way. we love to have members at large, even if you're not close to a chapter. But we have chapters, we have 300 chapters. So a lot of chapters are out there that are probably closer than some people might think.
That's great. And that's an important question, especially as you had said before, Andrea, about having that social support really is invaluable. So we're going to ask you just one more question. And I think this is probably something many people struggle with. I'm a caregiver. My husband is telling the doctor that he feels great, but I know he's really depressed. How can I help if my husband isn't telling the doctor the truth? And I know you touched upon that, Andrea, towards the latter part of your presentation when you talked about the importance of webinars. But if you can just speak to that question and just expand on what you had said earlier. Thanks.
Yeah, and I think that this is very common, especially when the patient wants to really show that they're doing well and they're feeling great. They're tired of going to the doctor, maybe. They just sometimes just want to get on with life, but they really are depressed. My first thing would be to have an open and honest conversation with my husband and say to them, you know, I see these things in you. Maybe you don't see the symptoms, but I do. Do you think that we could talk to the doctor together? Because as a caregiver, the main priority is to make sure that the patient is empowered as well. And so we don't want to take that empowerment away from the patient. We want to make sure that they're an active and involved member of the team. And then say, I really wish that you would let me go to the doctor with you and discuss it with the doctor with you there. And you never want to go to the doctor behind the patient's back unless it's a life-threatening, serious problem, because you really want to make sure that that patient is still getting that empowerment. And because sometimes the patient feels like they've lost all control and they really don't have any control over their situation. And so you want to make sure that you're building that empowerment to them as well. It will be better for them in the future. But encourage them and to talk to their doctor with you and ask them if you could go to the doctor appointment with them.
Thank you, Andrea. And thank you again to our audience for making the question segment of this webinar so lively. As I said, if you're thinking of something, probably somebody else is as well. We usually do keep the question section of our webinars brief. So again, if you asked a question and we didn't answer it, you will absolutely hear back from us via email. For now, I want to thank our audience for their time and participation and extend wishes that you have a wonderful rest of the week. And of course, thank you to Andrea and our partner, Mended Hearts, for sharing their expertise with the NeedyMeds audience. Stay well, everyone. Thanks for your time.
Thank you.